So now that we've talked about what food insecurity is, we'll address two specific programs that are designed to address food insecurity, SNAP and then SNAP Ed. So as you know from your textbook, there are a number of different types of food assistance programs. SNAP is just one of them, but we're going to focus on it in particular. Most of the programs in the United States are administered at the federal level, so like the USDA, and then the USDA usually has buckets of funds that they administer to different states and local agencies. So for example, in the SNAP program, SNAP is kind of this federal organization or federally funded program, excuse me, and then that money is distributed like to California. We have a program called CalFresh, which is just the California version of SNAP, and each different state can do it their own way. And the point of these federal assistance programs, again, came out of very early desire to both feed people and improve people's health, as well as support the agricultural industry in the United States. The USDA is always kind of working, I wouldn't say it dual purposes, sometimes it can feel like that, but it's got multiple goals that it's trying to deal with at the same time. So before we jump in to talk about SNAP, I think it's really important to briefly comment on the fact that there are a lot of stereotypes that may exist about people that receive federal assistance, whether it's through like welfare, like cash assistance, or through SNAP, which is formerly known, used to be known as food stamps. But I really want to make clear that, maybe through this lecture, just to sort of pay attention to some of the stereotypes people might have and why those really aren't true when we start looking at participants. One of them is that people are getting a ton of money. So you can pay attention to that. Are people getting a ton of money in these programs? Are people scamming the system? In fact, the rate of fraud is super, super low in these programs. Are people are people lazy and they're just not working? Well, you're going to see that that's also not the case. So just pay attention as we sort of walk through this, because SNAP is really mostly being used by working poor, meaning they have jobs, and elderly people and people with kids. Okay, so first we'll start with SNAP. You should know what it stands for. It's the Supplemental Nutrition Assistance Program, SNAP. And they used to call it food stamps because it was literal like stamps. But now they've turned it into a card, an EBT, Electronic Benefit Transfer Card, and it's just like a debit card. It's much more discreet and people can use it in lots of places. If we look at the total spending for the USDA in terms of where all the money goes, you can see this is a great chart that shows it. SNAP is really taking up almost 3/4 of total spending in the United States when it comes to food assistance. So SNAP is the blue kind of area, and you can see its budget has increased over time and is now actually on the decline. Some of this has to do with the fact that the economy has improved, and some of it has to do with the fact that our president has been cutting SNAP funding over time. So some of it is good and some of it maybe not. You can see the second largest proportion of funding is the school lunch program, that's in green, followed by WIC, and then the school breakfast program, and then CACFP, which is child care. It's like school lunch for child care and adult care, which we'll address later in the course. So you can see though, SNAP is really the big giant one. It's a huge part of our budget for the USDA. You may or may not be surprised to know that almost 10%, 9% of Americans receive SNAP. So almost 1 in 10 people are getting some type of SNAP benefit. Almost 20% of kids are getting SNAP benefits because they are, as you know from the previous video, they're most at risk, households with children. One of the reasons is that childcare is super expensive. So even if somebody wanted to work, if you have a certain number of kids, it stops even making sense if it's going to cost you, depending on where you live, $2,000 a month just to pay for childcare when you may not even earn barely that much if you work. So some people can't work because they can't afford to. I showed you it accounts for a large part of the spending. 43% of SNAP recipients are actually working, so they live in a household where people are working. So the idea that, oh, people in SNAP are just kind of freeloading and they're just getting these benefits because they don't want to work, it's actually not true. And again, many of the other people in that 60%, most of them are either elderly or disabled. There's a small contingent, just like in anything, of people that just aren't working and just are benefiting from the system, but it's very small. And the average length of time that people spend using SNAP is less than a year. It's about 10 months or less. So most of the people that are on SNAP are trying to use it to sort of move forward and launch out of this food insecurity phase, and they're using it for food. And lastly, fraud makes up less than 1% of the program. They actually have people whose entire job it is devoted to, analyzing fraudulent activities. To be eligible for SNAP, you need to be a U.S. citizen, and you have to have a limited income. So that's going to depend on sort of the different standards of what your household size is, and then if you're within 130% of the federal poverty limit. So if you can imagine, for a household of 4 people, you'd be eligible for SNAP if you're making $2,666, $2,665 a month, which is pretty low. So this isn't just being given out to anybody. I mean, if you think about your own income, some of you may actually qualify for SNAP, which you should take advantage of if you can. When we look at the actual amount of money people get from SNAP, a lot of times people think that SNAP beneficiaries are getting, like, they're just rolling in the dough and buying all kinds of food. The average benefit is $135 a month, and for households it's about $253 per household. So this is the average monthly benefit. This is as of 2019. So you can see the average monthly benefit for a family of 4 is $465. Now this is quite a lot lower in some states, and it's a little higher in others. So you can think of like Alaska or in Hawaii, where some products are going to be more expensive. Their monthly benefit might be higher. But if you think about Louisiana, that's going to be lower. Either way, when you average it out for a family or an individual person, it works out to about $1 to $2 per meal, which is really low. So if you imagine thinking about, trying to feed yourself or kids really nutritious foods, it's challenging. It requires a lot of time and effort, which many working poor don't have. What can people use to spend that money on? Again, it's debit cards. So it's cash that's put on a card. It can only be used for certain purchases, though, so it's not just for anything. Basically, any fresh fruits or vegetables, and many other just general food products, it can be purchased. But there's a lot of caveats, like you can't buy energy drinks and unless they have a nutrition facts label. But you could buy soda. There's not like a restriction on the quality of this food. You aren't allowed to buy alcohol or pre-made stuff like rotisserie chickens, like hot foods, pet food, household supplies. Unfortunately, a lot of people, diapers are super expensive, and so there isn't really that kind of relief for through SNAP. SNAP is really just designed for food, which is what people use it on. And people can use it at lots of retailers. This chart is just sort of showing you where people are using SNAP. So you can see these are the authorized retailers. So these are the different types of people that are allowed to accept SNAP, meaning they've gone through a process. They can use EBT. So you can see 35% are convenience stores. Only 17% of super centers actually accept SNAP. Others, that's going to be a lot of little mom and pop markets, liquor stores, grocery stores. If we see where the dollars are actually spent, most consumers want to get the most out of their money. And so almost half of people are spending them at super centers or supermarts. So when you think of a super center, like a Walmart or a Target. So, people are trying to use this to make the most of their money. They're not going out and spending it at, restaurants or something. Some people get a little concerned because they'll see signs like this. I don't know if you've ever seen, "We accept EBT." I saw this picture on the left with KFC. I saw it in Long Beach. I was driving around in West Long Beach, and I was like, why is KFC accepting food stamps? That seems so wrong. And I remember thinking, what is going on here? Papa John's Pizza? The reason for that is there's a special program in California called the CalFresh Restaurant Meals Program, and that is specifically for people that are 60 years of age or older, disabled, or homeless, so they can go into certain retailers and be able to get hot, pre-prepared foods. And if you think about why that might be, older people may not be able to cook for themselves. Excuse me. Oh, I'm so popular, somebody's calling me. Older people might not be able to cook for themselves. Same with disabled folks. Homeless may not be able to store food. So you could give them money to go buy food, but they can't prepare it. They can't store it. So again, this money is not going to last people as long, but it still is a way to relieve some food insecurity. So if you ever see that, you can, educate people that that's really for a very specific population of people. So does SNAP work? Is it helpful? Well, it's good in the United States. We've seen... Oh, I think I just answered the phone on accident. Whoops. So sorry about that. This is one of those days. SNAP is actually very efficient, so we see a lot of improvement in people's health outcomes. We see the quality of food that people consume is higher if they're on SNAP than if they're not. And, you know, it reaches the majority of people that are eligible. So about 75% of eligible individuals are on SNAP, which is great. The 25% though, unfortunately, aren't getting it, even though they should. Some of them are people like you, like students, who might not think, oh, I don't qualify, or that wouldn't be for me, but it is if you qualify. And then, people that are homeless or in rural areas, if people don't speak English, they may not actually know well, like where they could get SNAP or what they're eligible for. So next I'm going to briefly talk about the SNAP Ed program. So this is an educational arm of the SNAP program, and it started in the early 90s, sort of as a pilot in Maine, where they were trying to figure out, okay, well, people have this money, but they don't know how to buy healthy food with this money. And people are going and they're buying like Pop-Tarts and soda and, cup of noodles and really cheap food, which is fine. It's filling them up, but it's not healthy. So the USDA authorized funds to go to individual states to actually start doing education for SNAP eligible or SNAP eligible or SNAP participants. So the goal of SNAP Ed, which is now in all 50 states, is a very thriving, interesting program that many dietitians work for. It's pretty cool. The goal you can see here is to improve the likelihood that people that are on SNAP will make healthy choices within a limited budget and choose physical activity or physically active lifestyle. So there's really that two-part there. They want people to eat healthier and be more physically active because they see those two as really important for chronic disease prevention. People can eat a healthy diet, but if they're sedentary, they're not going to be at their maximum health. And they also really want to focus on primary prevention of diseases. So things like chronic disease, like cardiovascular disease and diabetes and hypertension. So the focus is really going to be on people that are older in general, because this is the population that's going to benefit the most. So many of the SNAP Ed programs are working with older people. Again, the people that are going to participate are anyone that's eligible for SNAP or is using SNAP. The activities that they do really vary depending on where they are, but they're going to be focused on behaviors. So if you think about, increasing people's capacity to do new behaviors like cooking and shopping, all of the programs are evidence-based. So they're based on, different trials where they've tested, does this work, does this not work? And then all of the SNAP activities, just like WIC, just like the school lunches, it's all going to be based on the dietary guidelines in MyPlate, which is why they're so important, right? So the SNAP Ed educators have to focus on this guide to educate people about what to eat. These programs are offered typically in person at venues where lower income people would be congregating. So SNAP offices, public housing units, food banks, anywhere you can think, senior centers, sometimes schools or childcare centers. So it really depends on the state and their population. And they're going to do anything from nutrition education sessions where they're, really having people come in small groups. They may do coaching or counseling. They may go to people's homes. There's a lot of ways SNAP Ed could work, but because it's public health focused, meaning you want to reach lots of people, it's usually going to be with multiple people at the same time. So either individual or group-based education. And you can see here in this little chart that there is a lot of improvement when people participate in SNAP Ed, whether it's getting handouts or flyers or actually participating in full intervention activities. You can see below some outcomes. They ate more fruit and vegetables and whole grains. Some really good things. They improved their nutrition practices and improved their food resource management, meaning they figured out how to use their money and make it go farther than it had been before. And lastly, they're able to improve food safety, because again, we take for granted that we know how to prepare food safely and how to store food safely, but a lot of people don't. And people may be purchasing foods and not storing them properly and then getting sick. So it's really valuable for people to learn that information too. And then to kind of wrap this part up, in the reading and in your reading questions, you have to learn more about other domestic relief programs. So I won't talk about them here, but just valuable for you to be aware of a few of them so that you understand that the government is doing lots of different things to try to address food insecurity. And then I posted an optional video. I'm not going to make you watch it, but it's worth watching even the first couple minutes, and it's showing what SNAP Ed looks like. I think they're doing it here. It's somewhere local here in Southern California, and you can see what the outcomes look like for seniors and how they're trying to make it culturally appropriate. All right, so we're going to move on next and talk about what's happening in current events.